for you tonight. And that is, trees are far more important than even the most ardent advocate among you believe. You're all probably underestimating the value of trees. And I think that trees should be considered an essential part of both our public health and our public safety infrastructure. But before I talk about the results from specific studies, I'd like to talk about one of the problems that can come up when we do research on the health benefits of trees. I do what's called observational research, and that simply involves trying to identify patterns in data that you can collect. That's in contrast to experimental methods where you actually do something, like you give somebody an experimental drug, or you conduct an experiment of some kind. You intervene in the world. In observational research, we don't do that. We simply collect data and we try and see patterns in those data. However, one of the problems with looking for patterns in data all day long is you start to see patterns, particularly causal patterns, where they don't really exist. So you start to believe that NFL teams with more vowels in their name are more likely to win the Super Bowl, or baseball teams with white uniforms are more likely to win games on a Tuesday, something like that. Now, it's not to say that teams with more vowels in them aren't more likely to win the Super Bowl. It's simply that it's not the vowels that are helping them, right? That isn't part of the causal mechanism. Similarly, teams in white uniform may win more games on a Tuesday, but it's not the white uniforms that are helping them to do that. So what's one way to avoid seeing these sort of spurious causal patterns when they don't really exist? Well, one really good way is, before you ever collect any data, is that you have good reasons to think two things are linked. So in the case of trees and health, do we have good reasons to think that they are linked? Or put another way, how could trees improve a person's health? And really, there are some pretty intuitive links. You don't have to think about this very long. For example, we know that trees can absorb air pollution and increased risk of a whole range of diseases. We also know that if you were to go outside now and sit under a tree, your short-term markers of stress will go down. Your salivary cortisol would go down. Your blood pressure would go down. Your heart rate would go down. And in some ways, that might be just not listening to me, but some of that would be because of the tree. And absolutely, as we know with air pollution, stress puts you at an increased risk of a whole range of diseases: cancer, heart disease, lower respiratory disease, the big killers in this country. We also know that people who live in greener neighborhoods have more social connections. And social connections have a really important impact on our health. If we learn nothing else during the pandemic, we learn that. Being lonely is incredibly bad for you. And then finally, it's not the only mechanism, but finally, for the moment, we know that people who live in greener neighborhoods are more likely to exercise. And Lord knows we've been told enough times that exercise is good for us. So, given that it's reasonable to hypothesize that trees can improve our health, let's go back 12 years into sort of the mist of time and look at my first trees and health study, which was looking at the relationship between trees and birth outcomes. Now, why on earth did I choose birth outcomes? Well, for a number of pragmatic and practical reasons. First, there's a statutory requirement to report births in this country. So there's over 99% of births that are reported. There's great data on in birth records. We know the baby's weight, gestational age. We know all sorts of things about the mother, race, education, age, same with the father. The type of data that you need to do my type of research. Second, and this is really important, there's a plausible story linking trees and birth outcomes. For example, we know that women who are exposed to air pollution and stress are more likely to have an adverse birth outcome. And as we just said, trees can absorb air pollution and reduce stress. And then the final point is that, and I say this carefully, and as a man who's never had kids, pregnancy only lasts 9 months. Why do I say that? Well, let's contrast. If we think of for the moment, if we think of pregnancy as a sort of, well, just for want of a better term, as a disease, I don't mean it in that sense, but if we just think of it as a disease for a moment, it's unusual in that we know what causes it, we know it lasts 9 months, and then we know it ends. And 9 months isn't that long. So if we have the current address where a woman lives, that tells us quite a lot about her exposure to trees over the course of her pregnancy. Now, in contrast, if we were interested in trees and heart disease, for example, heart disease has causes that can go back decades. If somebody has a heart attack at 70, their environment over the last 50 or 60 years may have influenced the risk factors. And so if we have somebody's address where they were admitted to the hospital having had a heart attack, that doesn't tell us a great deal about their exposure to trees over the course of a disease that goes back so long. But pregnancy has its nice 9-month window. So that's also very appealing. So in this case, we looked at 6,000 singleton live births that happened in 2006 and 2007. And we looked at 2 adverse birth outcomes. Small for gestational age birth, that is whether a baby's weight was below the 10th percentile based on their gestational age and gender. That's a huge mouthful. Well, that just means, was a baby born underweight? And the second thing we looked at whether a baby was born preterm, simply was a baby born before 37 weeks gestational age. Now, clearly, trees are not the only or even the main thing that influences a mother's likelihood of having an adverse birth outcome. Things like income, race, education, demographics, we controlled for those. We also controlled for previous births. We know if a woman's had an uncomplicated birth in the past, she's much more likely to have one in the future, for example. We looked at type of prenatal care she received, distance to stuff, so good stuff like parks, bad stuff like freeways. We even looked at crime around the house, because we know that crime can be a stressor. So only after controlling for all those things I talked about, want to emphasize that we took account of all those things. And having done that, we looked at tree canopy in 50, 100, and 200 meter buffers around the center of each woman's lot. So on the left here, you have just a high resolution aerial photograph. This was in Portland. And for privacy reasons, these are not women in the study. These are just random houses. And you see the green rectangle is is a lot's boundary, and the red dot there is the center. And on the right, you have what's called classified aerial imagery. And what you do is you break that picture into 1 meter pixels, and then using a computer algorithm, you classify each 1 meter pixel as either tree canopy, which is green, or non-tree canopy, which is the off-white. And in this case, I've only included the 50 meter buffers around each woman's house, just for simplicity, because it gets messy with the 100 and 200 meter buffers. So what did we find? We found that women with more tree canopy within 50 meters of their homes were less likely to have underweight babies. Okay, well, this is an interesting result, but maybe this is just one of those white uniforms on a Tuesday thing. It's just a statistical anomaly. And that's actually not the worst explanation. And I should say, when I published this paper back in 2011, nobody else had looked at the natural environment and birth outcomes. But then an interesting thing happened. So the next year in 2012, a friend of mine in Spain found that women with more greenness, and he measured this using satellite imagery, more greenness within 100 meters of their homes had higher birth weights. Okay, so consistent results. The next year in 2013, a team in Southern California found that women with more greenness within 50 meters of their homes had higher birth weights. So again, consistent results. 2014, a team in Germany found that mothers with more greenness within 500 meters of their homes had higher birth weights. Again, consistent results. And still in 2014, a team in Canada found that women with more greenness within 100 meters of their homes had higher birth weights. This is a particularly interesting one because the lead author of the study admitted to me afterwards, when he saw my initial study, he was like, that can't be true. That has to be nonsense. I'm going to set out to do a study to prove you wrong. And he ended up confirming our results. So this is definitely not somebody who was biased in my favor. Let's just say that. And I could actually go on and on talking about studies like this. Since my original paper, at least 30 studies have found a relationship between greenness and higher birth weights. So could one study be an aberration? Certainly. Could be a statistical anomaly. Could 30 be? Maybe, but it's an awful lot less likely. And I think I just want to pause here a second and say, like, if you can actually see me, imagine I was to have a healthy weight baby in this hand and an underweight baby in this hand. That the difference between the two might be a mother's exposure to trees during pregnancy. That's telling us something very profound about our relationship with trees. Because being born underweight or premature is not a trivial thing, it obviously increases your risk of dying or having health complications right at birth. But it also, to some degree, puts you on a health trajectory for life. You do worse in school, have lower lifetime earnings, you have more health problems. So clearly this is something to be avoided, if at all possible. And it appears, at least, that there's an association between trees and a lower likelihood of this happening. So this is interesting. However, all these studies do highlight one of the biggest headaches when you're studying the health benefits of trees, and that is what I call the nice tree, nice neighborhood effect. That is, as all of you no doubt know, in urban areas, neighborhoods with more trees, they're going to tend to be whiter, wealthier, and better educated. And we absolutely know that race, education, and income are major drivers of health outcomes. So how do you untangle those competing relationships? You've got a lot of cross currents there. Well, I and the other studies I've just shown you, you use statistical techniques to try and untangle this, but you can never be entirely sure that you've done a perfect job. And 10, 11 years ago now, I was particularly bothered by this problem when I realized I could flip my hypothesis on its head. And as was said in the introduction, you can look at this problem backwards. That is, if trees are good for you, which we think they are, that's a general hypothesis. If that's true, then killing trees should be bad for you, one would think. Okay, well, why is that such a grand revelation, or what passes for one in my case anyway? Well, because it opens up some new methodological approaches, because trees can die a lot quicker than they can grow, right? So you can see longitudinally, you can see changes in tree cover in a relatively short amount of time. You don't have to wait decades for tree canopy to increase. You can see in just a few years, at least theoretically, you could see a pretty drastic reduction in tree canopy. But you would, to have a big enough effect to actually impact health, because one tree dying isn't going to affect health, to have a measurable impact on health, you'd need a lot of trees to die in a short amount of time. What could do that? Well, unfortunately, invasive insects can do a pretty good job of that. And this little chap here, that is this handsome little devil, the emerald ash borer, is probably, unfortunately, in Oregon, we've now know has arrived in Forest Grove in 2022. So it's either in the Portland metro area, it's either here now or soon will be, unfortunately. So this is in our lives now for the foreseeable future. And it kills all 22 species of North American ash. To give you a sense of what is in store for us, this is a line of trees in Toledo in 2006 and the same street 3 years later. So really pretty devastating. This, we're in for a change here, that's for sure. Luckily for us, ash isn't a huge part of our urban tree canopy, but nonetheless, if it's untreated, it's going to die. Now, this is certainly awful for everybody in the country except me, actually, because it was a really unique opportunity. Because I'm going to show you a little animation here. This is showing the spread of emerald ash borer from Detroit in 2002 out to Oregon in 2022. And as you see it spread, ask yourself the question, can you imagine another major driver of health outcomes, something like race or education or income, changing in this way that would mimic this pattern? And no, race and education income, they don't change in this way. And you don't have to take my word for it. I've statistically tested this. What you have is, you do have this sort of regular wave-like pattern, but you see these random satellite populations like Boulder County there, just popping up hundreds of miles from the nearest infested county, just because it gets moved in firewood, for example. You'll see Tennessee popping up in a second here. And supposedly that was likely somebody moving firewood to a NASCAR race, somebody thinks. So you get these random events and you have this very unusual spread pattern, and it's unusual loss of trees. And why that's so crucial is if we find a relationship between this pattern and health, it's much less likely to be caused by something else, right? Because this isn't correlated with other things. So that's the real statistical gift. So what type of diseases could be caused by the loss of trees? A whole range. So I decided to look at cardiovascular and lower respiratory disease because they certainly plausibly could be, and also they're important causes of death. They're the first and third biggest killers in the US. So big causes of death. And I chose to look at county level mortality. And these black squares are counties. And I looked at mortality rather than just sort of incidence of the disease, again, just for data reasons. We have good data at the beginning and the end of life. So we have really good data on mortality. So what did I find? Well, I should say we went from 1990 through 2007. So we went 12 years, well, 11 years without the bug. We watched it spread. We add the bug in 2002 and we wait another 6 years and we see what happens statistically. And what we found is counties infested with emerald ash borer had higher rates of cardiovascular and lower respiratory mortality. And interestingly, as the infestation progressed, so as more trees died, we actually saw more people die. So we saw this dose-response relationship. More trees dying, more people dying. We also saw a bigger impact in wealthier counties. Why would that be, do you think? Well, for the reasons you probably would imagine. Wealthier counties are going to have more better maintained trees, providing greater health benefits. You take them away, you would expect bigger negative health benefits and bigger negative health effects. And that is what we found. And across 6 years and 15 states, we saw an additional 15,000 deaths from cardiovascular disease and 6,000 from lower respiratory. So an additional 21,000 deaths. Definitely not trivial numbers. And when you get results like this, the temptation is to sort of yell them from the rooftops. That's not a good idea, because if you do that prematurely and somebody else finds a mistake in your work, then you face public humiliation. If you had found that yourself, then you would face private disappointment. Having faced both, I can tell you that one is significantly less unpleasant than the other. So I carefully closed my office door and tried to disprove my results. And one way I did this is to look at the relationship between emerald ash borer and a cause of death it couldn't plausibly affect. And specifically, I looked at accidental death, right? Because beetles don't cause car accidents. There's no plausible way in which emerald ash borer is going to increase accidental death. And we found no association. So that's encouraging. We found an association between the emerald ash borer and two causes of death it could plausibly affect. That is cardiovascular and lower respiratory disease. And we found no relationship between the emerald ash borer and a cause of death it couldn't possibly affect. That's accidental death. So that's good. Not definitive, but good. And since I did this original research, several studies have sort of confirmed the findings and shed some light on the mechanisms that may be at play. So, for example, this figure, let me show you. Yes, hang on a bit. Oh, that's to go backwards there. Is that, here we go. So this figure, it comes from a paper that looked at the effect of EAB on the likelihood that somebody engaged in outdoor recreation. So we'll just look at this figure up here. So the vertical axis shows the probability that somebody engages in outdoor recreation. And the horizontal axis there is time. And you see here, that's the year that EAB arrives in a county. So you see it's bobbling along. And as soon as EAB arrives, the probability that somebody engages in outdoor recreation drops. And it does go up a bit, but it stays lower than baseline for 5 years. So what that tells us is that reductions in exercise and outdoor recreation may be one of the mechanisms whereby loss of trees is associated with these causes of death. Now, explaining these results to people without a scientific background can be challenging. It's often a good challenge, but it can be tricky. And few years ago now, a reporter from Wired magazine called me because he was writing a story about a different invasive pest. That's the polyphagous shothole borer. I'm always glad when I can say that in one go without tripping over my tongue. That happened to be, is definitely not one to drink before saying that, but it was, at the time, it had recently appeared in Southern California. And he was unusual, actually, for a reporter. He was specifically a dedicated science reporter. He'd actually read my paper, which most don't, and he asked smart questions. So I wasn't as worried that he was going to get things wrong. Perhaps I should have been, because this is the story that he wrote. As you can see, maybe just a tiny bit of the nuance may have been lost in this particular article. So say my wife is a science writer, and when she saw this, she laughed so hard I thought she was actually going to harm herself. So it's always good to know that it's just a cautionary thing for science communication. Now, I think that the results from this EAB study are compelling, but of course, I would think that, but in the years since I did the study, I've wondered whether the opposite was true. That is, if loss of trees is associated with increased mortality, would tree planting be associated with decreased mortality? You would think, you would hope that it would be that this would be a sort of there'll be the effects would go in both directions. The problem is, and I alluded to this earlier, to do a study like this, you would need years, or well, realistically, you would need decades of tree planting data, because trees take a long time to grow. And you need to be able to track them until they get big enough to have an impact on health. And I just didn't know where to get tree planting data of this sort. And then a few years ago, I was talking to a friend of mine who's a colleague, works for Friends of Trees, as you probably know, in Portland. And just in passing, we were talking about something else. She mentioned that Friends of Trees had 30 years of tree planting data. They had the date and the address where they planted 50,000 street and yard trees. So I couldn't believe it. And because I just, this is sort of the great white whale here. I didn't know that people had these sort of data. They kept them. And they were nice enough to give me access to the data. And so having got the tree planting data, I had to get corresponding health data. I talked to the Oregon Health Authority, and I got access to census tract level mortality data. For those who don't know, census tracts is just a geographic unit used by the US Census. Typically 3,000 to 5,000 people living in a census tract. There in Portland, there's about 140 census tracts, so they're roughly the size of a named neighborhood. You can think of this as we looked at neighborhood level mortality. And initially what we looked at is non-accidental mortality. Why this? Well, again, I talked about this earlier, because typically in these studies, there's no way which tree is going to affect accidental death. So you typically just take accidental death out of the picture. So we looked at non-accidental mortality. And what we did then is we calculated two types of tree planting variables. Just simple, in each neighborhood, how many trees have been planted in the last 15 years, just total trees planted, very simple. And then we looked at number of trees planted in 3 age bands. That's 1 to 5 years, 6 to 10, and 11 to 15 years ago. Why break up into these 3 age bands? Well, because a priori, we would expect, as trees age and grow, we would expect them to have a bigger impact on health. For example, as trees get bigger, they get more leaves. More leaves means their increased capacity to absorb air pollution. Just one thing. So we would expect this to happen. And indeed, if we didn't see it happen, we would be concerned. So I'm just going to jump straight to the results here. There's a very simple table here where the 5 variables that we found associated with non-accidental mortality. And income, this was the first one. And we found that neighborhoods that were wealthier had lower mortality rates. Again, not at all surprising. You see this in basically every epidemiological or public health study. There's a very strong relationship between income and mortality. Then we found neighborhoods that were on average older, had higher rates of mortality. Again, not surprising. It just turned 56, so a little disappointing that getting older makes you more likely to die, but statistically not all that surprising. And the same with education. We found education, neighborhoods with higher education rates had lower rates of mortality. Again, none of this is surprising. We see this in lots of studies. There was mildly surprising when we looked at race, we found it was not significant. I think there's a couple of things could be going on there. One, Portland's just a very white city, so we just don't see a lot of variation in race. So it just may just be just a statistical issue. And then the other one is we already had income and education in the model, so maybe to some degree they had captured an impact of race. So all those are the kind of standard variables, and now we get to trees. So we looked at trees in the last 15 years. And what did we find? Well, we found that neighborhoods with more tree planting in the last 15 years had significantly lower rates of non-accidental mortality. Well, this is great. It's certainly good that you found a statistically significant relationship, but that's only one thing. The other thing you want to know is this relationship, although significant, is it the magnitude big enough to care about? Because sometimes you get highly significant relationships that are just of a trivial magnitude. They just don't matter. And what we found in this case is, on average, Friends of Trees planted 1,638 trees a year. And we found that that number of trees was associated with, on average, a reduction in 15.6 fewer non-accidental deaths a year. So not a trivial number of reduced deaths in a city of 600,000. Or another way to look at this, which I think is just a lot more immediate, is roughly speaking, we saw one averted death per 100 planted trees. And that's, I think, I found that, quite startling, that result. So that was our overall result. Now, what about the effect of tree age? Okay, so we'll show you another little table here. So what I decided to do is say, let's just take that average annual number of trees planted, that's 1,638, replant them, and then let's wait 1 to 5 years after planting, and then see, and I should say, when I say 1 to 5 year old, that's not true. What I really mean is 1 to 5 years after planting. And these are 2-inch caliper trees. These are 4 to 8 years at planting. So just bear that in mind. So we have 1,638 trees. We wait 1 to 5 years, and we find that they're associated with 11.6 fewer deaths. So, hey, that's good. But then let's wait another 5 years. So now the trees are 6 to 10 years after planting. We found those associated with 19.7 fewer deaths. Okay, well, that's good. How about we wait another 5 years, let those trees get even bigger still, 11 to 15 years old, now 23.1. So we're seeing exactly what we hope to see. And this graph shows you that, yes, as trees age and grow, we saw an increase. As they get bigger, we saw an impact on bigger impact on mortality. And you also see that kind of a diminishing marginal effect, which you would also expect to see. Right. 1 second here. So this is all good. Now, a big part of this study was to compare the results to the emerald ash borer study. And in that case, we looked at cardiovascular and lower respiratory disease. So let's look then at specifically those causes of death. And here we find, I'll show you the cardiovascular disease. We found that if you have more trees planted in the last 15 years, it was significantly associated with lower rates of cardiovascular disease. Very significant relationship. So again, consistent with our emerald ash borer study. Now, when we looked at lower respiratory disease, it was a different matter. So 5% significance level, we didn't see an effect. We just about saw in the 10%. So not as startling a results, but very clear results for cardiovascular disease. And we also looked at accidental death, not non-accidental. We looked specifically accidental death, and we don't want to see a relationship here. We want to make it non-significant, and that is what we found. So that was encouraging. And just take a moment here. I just want to emphasize that the emerald ash borer study and this study were completely different studies. One was a regional study, one was in a city. They measured trees differently. They had different health data, the different study teams, different statistical models. They're just very different papers. I was about the only thing that had in common between these papers. Nonetheless, you found consistent results. You found in the case if we lost trees, we saw increases in cardiovascular disease. If we plant trees, we saw decreases in cardiovascular disease. And so I think taken together, these two studies show some of the strongest evidence that trees are associated with improved health. Now, because this study, we were looking at a specific action, that is tree planting, it allowed us to do a little bit of a cost-benefit analysis. I'm an economist, so I can't help myself. And so we decided to do a very simple one. We said, okay, let's imagine planting one tree in each of Portland's 140 census tracts. So 140 trees. And to do this, I had to make a couple of assumptions. First, based on a 2005 study, I assumed that the annual planting and maintenance costs of a tree was $58.70, and I'd adjusted that figure for inflation. So if you multiply that by 140, it gives you a total annual planting and maintenance costs of $8,218 to plant one tree in each of the 114 neighborhoods. Okay, that's the cost side, but what about the benefit side? How do you put a dollar figure on reduced mortality? You think that's impossible? Well, the EPA has to deal with this problem all the time. So, for example, if they're trying to look at the costs and benefits of, say, tighter regulations on energy production, then they know that those regulations will increase costs on, say, power generation. But if it reduces the number of people who die from diseases associated with air pollution, how do you compare those two? And I won't go into the science of it, but it is actually pretty solid. And what they come up with is that saving an anonymous adult death has a value of about $10.7 million. So if in our model tells us if you plant 140 trees in Portland, you'll avoid 1.33 deaths. So if you take 1.33, multiply it by 10.7, you get benefits of 14.2 million. Remember, the costs were 8,218. So for those of you who haven't done the arithmetic already, that is a benefit cost ratio of 1,727 to 1. So quite startling. Remember, human life is very valuable. In consequence, healthcare is very expensive. Trees are extremely cheap in comparison. And 1,727 to 1, I mean, even those Nigerian email scams we used to get wouldn't offer you rates of return like this. I mean, this is just flamboyant in its rates of return. It's ridiculous. But that's the type of thing we're talking about here. And remember, these aren't all the benefits that trees provide. This is just a subset. And already we're seeing them being, and it's the entire costs and a subset of the benefits, and you're seeing 1,700 to 1. So interesting. But now I would like to change track a little bit and spend the last few minutes here talking about the relationship between trees and crime. Crime reduction, again, another complex benefit. And a good starting point for this discussion is a study that was done way back in 2001 by Quo and Sullivan, and they looked at the relationship between trees and crime in a public housing development in Chicago. Now, it's quite a famous study. Some of you may have at least heard of it being mentioned. And it was a very clever study. And as I go on in my scientific career, I certainly value, say, statistical competence or people who are very careful in their science, but I really have come to respect and admire cleverness when people do something really clever. And these people did something clever. And I now know Bill Sullivan, one of the authors. And what they took advantage of is that this study was done in a housing development called the IDB Wells Public Housing Development in Southside Chicago. And if you apply to live there, there's a series of apartment blocks. And you can't pick which one you go to. You're just randomly assigned to one of those buildings. And to a scientist, you hear random assignment and you get giddy. This is wonderful. Why? Because you shouldn't be, if there's random assignment, people who live in different buildings should be no more or less likely to commit a crime because they're randomly assigned. Wonderful. Despite that random assignment, they found that apartment blocks with more trees around them had lower crime. Really interesting. Again, to say, very clever study. But like all sort of groundbreaking studies like this, and this is not a criticism at all, but it raises as many questions as it answers. So, for example, Ida B. Wells is a very poor, almost exclusively African-American, very high rates of unemployment, social deprivation, this area. Question is, would we see the same? Is it just an artifact of that sort of environment, or would you see the same relationship between trees and crime in a typical suburban setting? Also, I'm an economist, and I have a typical economist disdain for other social scientist quantitative skills. And these two, quotes, all of them are psychologists. I mean, they're not like sociologists or something appalling like that, but so they're not too bad. But I wondered, and I'm partly joking here, I wondered if we use some different and more sophisticated statistical techniques, would the results hold up? And so that's what I set out to do. So this study was done in Portland, in a couple of neighborhoods in Southeast Portland, where I live. And I looked at a sample of 2,813 single-family homes. And if you're wondering how I came up with a sample size of 2,813, well, I tried to go for 3,000, but my student rebelled near the end and wouldn't go out anymore. So 2,813 it was, not too bad. And before we visited any of these homes, I talked to some crime prevention folks because I wanted to know, clearly trees are not the only thing or the main thing that affects crime. We wanted to know, what are the other environmental factors that affect the likelihood that you're going to have a reported crime at someone's home? And, what can we do to account for those things? And one of the things that they really emphasized, and I was a little surprised by this, was that they really emphasized that visibility around a house was key. So anything that reduced visibility, so say a solid wood fence around somebody's house, or overgrown vegetation or poor lighting, that they were very clear about, that would increase the probability of crime. In contrast, anything that improved visibility, so good sight lines, street lights, or security lights, that they said, that will reduce the risk of crime. And they talked about a lot of other things as well, but I think you see that view obstruction is a major factor here. So we went to every one of these houses and we measured a few dozen variables. So we looked at trees and other vegetation. We looked at barriers and visibility. We looked at the condition of the home. We looked at street lights. We looked at garage. Does the house have a garage? Because one of the crimes we looked at was a car crime. And what did we find? Well, let's begin with street trees, because that was a really easy, happy story. We found that, and by street trees, I mean, like in this case, the tree that's in the green strip between the sidewalk and the road. That's what I mean by street tree. We found that, on average, houses with more street trees in front of them had lower reported crime. So that's great, happy story. Now we get to the yard trees, and that was not so easy to understand at first. Although, as you'll see, I think sometimes the results that are harder to understand at first end up being the most interesting. But what we found is, for larger yard trees, in this case, and we found a very specific cutoff. If a tree was taller than 42 feet, if it was taller than 42 feet tall, it was associated with lower crime, as in this case. If it was smaller than that, smaller than 42 feet, then it was associated with higher crime. Now, like, what is this about? How can trees be both associated with higher crime and lower crime? This doesn't make any sense. And to try and explain these results, let's begin by trying to explain how trees might increase crime, because that's actually easier and a little more intuitive. So anything that could provide cover for a criminal or stops people seeing out, as in this case, may help provide cover for a criminal, may stop people being observed. It may help. And there's a criminology, I wouldn't call it a theory, but what it's called is crime prevention through environmental design. It's a very popular theory or practice in criminology. And what that says is that anything that causes view obstruction can potentially increase crime. And the people who advocate crime prevention through environmental design, I think what they want us all to live on is 10 acres of, a 10-acre concrete slab with light shining on us 24/7. And that would be the perfect place to live as far as they're concerned. And I'm being slightly facetious, but not entirely. But if you through this sort of crime prevention through environmental design worldview, vegetation of any type is purely a bad thing because that can only cause view obstruction. And certainly what we found in our results is that, yeah, this is consistent with our results. For example, we found houses that had view obstructing barriers around, like this fence, people were more likely to have reported crimes. Conversely, houses with a street light in front were less likely to have crime. So we did find other evidence that views and view obstruction mattered. Okay, so that makes sense. But why on earth would there be this 42 feet cutoff? That's truly bizarre. And I was racking my brains about this. And so my student, having spent a week or two indoors, I managed to coax her back outside and said, hey, can you go and measure the height of 100 trees and also the crown height? So, the height is obvious. The crown height is how far up the tree the crown starts. Why measure that? Well, because the crown is really the part of the tree that causes the most view obstruction. An interesting thing, so for a 42 feet tree, I found it on average crown height, the crown started 9 feet up the tree. I then sent her out and said, can you measure the top of 100 first floor windows? And she went and did that too. She wasn't happy, but she did. And I found that came out as 9 feet, almost exactly. So why I think there's this 42 feet cutoff is if trees are taller than 42 feet, the crown is clearing the top of the first floor window and they're not view obstructing. If it's shorter than that, then the crown may be obstructing views to a greater degree. Okay. Well, that explains why trees might increase crime, but I'm not just saying that big trees don't increase crime, I'm saying they actually decrease crime or are associated with decreased crime. How could that possibly be? Well, in Quo and Sullivan's case, what they thought is that trees may bring people out into a public space. And in their study, you had these apartment buildings and large amounts of public space between them. And I think that makes sense. So if you make the area around one of these apartment buildings more appealing, more people spend time outside. If somebody is to commit a crime, they'd be more likely to be seen and reported. So I think that makes sense. And that may be contributing to the effect we're seeing that we found in Portland. But in a suburban setting, there's a lot less public space, rather. So what could possibly be causing it here then? Well, there's a number of things, but are any of you familiar with the broken windows theory of crime prevention? It had a big it had a heyday in the 80s in New York where it was used by Giuliani. I think the crime commission was called Bratton. Does anybody remember him? It was a big thing. And it was somewhat politically contentious how they used it. But the broken windows theory is very simple at its core. What it says is that if a neighborhood has signs of decay, so things like broken windows, graffiti, garbage, it sends a subliminal signal to a criminal that if they were to commit a crime, they'd be less likely to be reported and less likely to be caught. And there's quite a bit of evidence to support this. Now, what I think is that a mature tree is the exact opposite of a broken window. It sends a subliminal signal to somebody that a neighborhood is well cared for, that if they were to commit a crime, they'd be more likely to be seen, more likely reported. To be clear, I'm saying this is a subliminal signal. This is not a conscious thing. I'm not saying somebody with a little black mask on and a swag bag over his shoulder is creeping up to your house and they're about to break in and go, ooh, big leaf maple, and run away. don't think that's what's happening here. Except, I mean, if they have a maple allergy or something, I guess, but probably not. So, but nonetheless, despite, I think this is what's happening. The mature trees really do they tell us something about the neighborhood. So, and our results here would have just some very clear implications for tree planting maintenance. Clearly don't plant trees in a way that block views, that view obstruction. Best to, just plant trees in sensible places in the first place. If there are trees that are blocking views, then prune them, limb them up to minimize view obstruction. Because I don't think just with a little thought and a little maintenance, you can maximize the crime prevention part of trees and minimize their capacity to increase crime. I don't think that's all that difficult to do. So I'm really done throwing numbers and graphs at you because I've thrown a lot at you, and I apologize for a lot of numbers in a short amount of time. But what does all this mean? Okay, well, hopefully I've shown you that the most obvious benefits of trees aren't necessarily the most important ones, right? Rather, these less intuitive benefits, such as crime reduction, and in particular, improved public health, are the most important benefits that trees provide. Health in particular is really profoundly important. And what this means is that effectively communicating the full range of benefits that trees provide is not straightforward. You're not just saying, hey, nice tree provides shade. Everybody can understand that message. It's an easy message. It's a little more complicated than that, and it's a little less intuitive. But it does mean that the stakes are a lot higher. And that I think we need to deliver the message that urban trees are an essential part of our both public health and public safety infrastructure. And if we can get that message across, if we can effectively communicate what they can do, then I think our cities will be greener, healthier, and safer places to live. And so that is all I have for you. And now I will be happy to answer any of your questions. And the first question you obviously have, who is that delightful dog? And that is Georgie, my puggle. And she's also, I should say, she may be able to see her sitting right there. So she's been keeping me company while I give this presentation. Haven't you, Georgie? You good girl. Anyway, I'm happy. Again, my apologies for the mix-up. I really don't like doing that. I'm glad it wasn't too big of a problem. Thank you very much for your time. I do appreciate it.
Wow. Thank you. Thank you very much. This is really an eye-opener for me, especially.
Thank you.
Any questions from the audience? I don't see anything on the chat, so if feel free to ask any questions at this time, please.
I think I see somebody with a hand up.
Yeah, Fran, go ahead. No, Fran?
Actually, Mary Lou was before me, so let's take Mary Lou first.
Oh, well, first of all, I want to thank you for all this information, and it helps me when I go to neighborhood meetings where a proposed developer is a proposed project is going to go in, and his idea is to mow down every tree. It helps me when the neighbors are attending these meetings. This is more evidence of why it's important to keep mature trees.
Yes.
Because planting trees is great, and planting certain trees, certain kinds of trees is great. But it takes a long time for those trees to grow to maturity. And so it's we've been trying to send a message to the county that they need to stop chopping down street trees that are 20 years old.
Yep.
In order to, put in an extra turn lane or widen the sidewalk from 6 to 9 feet or something, and then they chop down all the trees. To me, that's just wrong. And this gives me more ammunition to save the trees.
I'm glad you brought
thank you.
up. No, that's an excellent one. And I'd actually meant to make that more clearly. When you saw that as the trees get bigger, they have a bigger impact on mortality, that's exactly the point. It means that retaining trees is as or more important than planting. I mean, they're both
Yes.
part of the same thing. If you never plant, then you're going to get in trouble. And that's the only way you can, increase. But yeah, retention is enormously important. And I should say, for every, study, I tend not to throw up a lot of technical detail, but for all these studies, I have, there is a published paper, and I typically have a 2-page fact sheet, which, can be used, say, if you have a neighborhood group and you want to present that information in a sort of more digestible format, and I can get those to you as well.
Excellent.
If you find those useful.
Excellent.
Not at all. I appreciate it.
Thanks.
Franco?
Yeah. First of all, I want to thank you very much, Dr. Donovan, for taking your private time to speak with us here.
No.
This was very helpful and plugged in some additional holes in the numbers and facts we have, which was great. And I have 2 questions. One is a lot of things I get about you're talking about the lower respiratory problems, and in particular asthma. What I get from a lot of families is, yeah, but the trees pollinate and then those cause more asthma for my children. So
Yep.
that's one of my questions.
Yep.
Have we done any studies that show that may not necessarily be true, or do we have any
Yeah.
facts?
No, that's a very good question. And I've done some work in New Zealand specifically on asthma. And that the thing about asthma or any allergic disease is that you can have things go in 2 directions. So what you may have is that the evidence does suggest that exposure to trees and other diverse greenness is associated with a reduced risk of developing asthma. However, certain plants and certain tree species may exacerbate symptoms in susceptible individuals. So it's important to distinguish between those 2 things. It's the same thing like with peanuts. Right. We now know, we used to say we don't expose kids to peanuts because we don't want to develop peanut allergies. We don't want to kill them. Now we know that exposure to peanuts at early stage makes you less likely to get a peanut allergy. However, if you've got one, you definitely don't want to be exposed to them. So it goes in both directions. But early life exposure to trees is to the natural environment more generally, there's strong evidence that that's associated with a reduced risk of developing asthma and indeed other immune diseases. So I've done some work on childhood leukemia, for example, reduced risk there. Also reduced risk of ADHD, for example. So yeah, but there is that possibility. Certainly, say you don't want to expose tree pollen, like a highly allergenic species like certain pine species, you definitely wouldn't want to expose a kid who has asthma to that.
The second question has to do with, by the by, in Washington County, we have a program beginning. We're joining this EAB preparedness, and we have a number of different organizations, which Tree Keepers is kind of we're networking with different groups to try to get this going. And in particular, now we're looking at EAB preparedness in schoolyards, so that maybe even succession planting before the trees have perished or whatever, so that whenever we do a tree inventory around a school, we look and see where there may be trees infected, and then identify what we can be doing in the succession planting, so that the children don't see this massive absence of cutting down all the trees and then waiting years before other trees can come back. So we are looking at all those different things, and Washington County definitely has a challenge when it comes to the EAB situation. So we're hoping we can help them with that. But my other question is, what can we do to help you in your research? Do you ever need partners to help with things? Because we have volunteers who do things like tree inventory, although we put that on pause temporarily because we didn't have a good use for the data at this point.
Mhm.
But we are also on the ground kind of folks and networking. So please let us know if there's something that we can do to collaborate with you on this kind of stuff, because this has been extremely helpful. We want to keep things in a positive vein here.
Oh, well, first of all, thank you for that. It's very, very kind. I really appreciate that offer. The answer is yeah. Well, there's a few things for sure. One is data. So, for example, that study on tree planting and mortality, that was just because Friends of Trees happened to have been collecting good data for decades. So things like tree inventories, for example, can be very useful to me. So just carefully collecting data is very useful. I also, if you, for example, next year, I'm going to be doing some work on trees and sound, natural sound. So for example, trees, yeah, so trees can both buffer, unhealthy sound, but can encourage natural sound. So I'm going to be doing some data collection around Portland. And yeah, I mean, if people were interested in coming out and helping, that would be great. I would absolutely appreciate that, even for a little bit. So yeah, but I think the data collection thing is key. That and just being if you can, for example, tree inventories, those things are enormously important. So yeah, anything that involves long-term collection of good, high-quality data is almost certainly useful to me. And often the case is I don't know what organizations like you are collecting, so I don't even know what's available. So sometimes it'd be nice to have a chat and just say, well, what information do you have? And then you can often, I'm quite pragmatic in how I design my studies. I find the data source first and design the study around that. So yeah, but thank you for the offer. That's it's very kind of you.
Yes, I have spoken with one of the professors at PSU about having a common repository,
Yeah.
some kind of warehousing of the data, because we have so many different collectors and
Yes.
stovepipes of information. And so there's a lot of duplication of efforts and disjunct things. So if you're interested in that kind of thing, maybe I would like to get people who are doing this research and have this kind of data and figure out a way that we might be able to maybe get some mapping of the data, et cetera, so that it can be more useful.
Yeah, that would be great. There are, there are public data repositories that you can deposit these data in and in a form that make them usable to other people. I mean, it can be a little bit of a chore to get the metadata together and to get them in the form that these repositories want. But once you can, if you can get them in these repositories, then yeah, then you make that data enormously more valuable because it's available to, and in your case, you're not trying to keep the data to yourself. Quite the contrary, you're hoping to get people to use it. So,
right, especially the planners across our county, because
yes,
the planners need this information.
By the way, have you had any cases of EAB yet in Washington County?
Yes, we have it in Forest Grove, and also we just had a walkthrough of this area in Beaverton where there are some signs of it, and we're trying to pinpoint it for sure. But we believe that, I don't think that inoculation is going to work here because of the expense. But again, I'm not an authority about EAB, but I know who to contact.
Yeah. So, well, I think
identify the stricken trees.
In the case of schools, I think that's a case where some sort of treatment to avoid, as you say, that sudden loss of canopy, where you can have a staggered, rather than cutting 15 trees down in 1 year, you cut one tree down every 1 tree a year for 15 years and replant, and so that kids don't see that really, that stark loss of tree canopy, which sometimes I will do these when I do these sort of presentations. I've used variety of ways to get people to think this way, but there's a great poem by Seamus Heaney, and he writes about the loss of a chestnut tree. I don't know if you know this one. It uses a metaphor for the death of his mother, and it's very evocative. And if you ask people to close their eyes and remember the loss of a large tree as a child, nearly everybody can. And, you know, remember what it looked like and what it felt like. I remember there was a big sycamore tree. It was really young. And so when you're young, you're just kind of goofy. You don't imagine that the world's going to change, you know, why would, and this big tree was lost behind a house, neighbors, and it was like there was a hole in the sky, you know, it was very shocking. And so you certainly don't want to expose kids to like really big changes in tree canopy. I just don't think that's a good idea at all.
Any other questions from the audience? I see there is a request in the chat to get additional resources on the benefits of large and mature trees. Maybe you can send a link or something, or later after the meeting we can post it if it doesn't come to your mind.
Well, I can definitely, I can send you that paper that shows that as the trees get bigger, you see a bigger impact on health. I can absolutely send you that. And in fact, what I will do, part of the reason why I'm a bit scrambled is that I'm going on vacation on Thursday soon, so Friday morning. So that's why I was a little scrambled. But when I get back, I can send a paper and a fact sheet for everything that I've talked about today. So that would be half a dozen or so of each. So I can send those. And then if you look at those and you want even more information on a particular subject, then I can chase that down.
Thank you. We can post it on our website and for others to see as well.
Thank you.
Any questions? Anybody raising their hands? I don't see any hands. I'm actually curious on you mentioned about the benefits of trees on health, and specifically cardiovascular. Is there any established explanation on like the biology of how that is happening in the body? If are there any research or besides the causal and effect, you know, and the data gathering, is there any understanding of the metabolism or the biology that is occurring as a result of having more trees on cardiovascular situations?
There is one of the things, it can be very difficult to experimentally study this, right? Because trees are hard to experimentally manipulate. But there has been a study done, the Green, is it in Louisville, Kentucky, the Green Heart Project, and where they did do a large-scale tree planting, and they're just starting to get some results out there. And I mean, these are done. One of the PIs of this is a cardiologist, so they're starting to get. First, they're starting to get some actual causal results, which is incredibly valuable because just across the green health space, there's very little experimental work. So that's great. As to the sort of mechanisms involved, can we say anything definitively? No, but almost certainly some of those things I talked about at the beginning, stress reduction, I think is highly likely to be an important mechanism in the case of cardiovascular. I think there's also, I've done some work on the microbiome, so this may be involved. So it may be that not just trees and plants themselves, but the bacteria that live on the leaves may actually be quite helpful. So when you're exposed to those sort of diverse bacteria, that can help, particularly for kids, their immune systems to develop properly. So I think there may be some of that going on. I think certainly air quality is difficult to imagine that isn't involved. We know we do have experimental work showing for sure that trees can absorb air pollution, so that's a given. And the epidemiological evidence that air pollution is associated with disease is so overwhelming that it's difficult to imagine that air pollution, improvements in air pollution is not part of that mechanistic pathway. Other ones, as I suggested in the case of cardiovascular increased physical activity is probably part of it as well. But all this is to some degree sort of educated speculation. And certainly if you're talking about real mechanistic things like which inflammatory marker is changed and so forth, then that looking at the green health folks and because they are tracking particular biomarkers. So that's they're doing the sort of most cutting edge work there on those, specific pathways involved.
Thank you. That's very interesting. And
No, they're doing great work.
it's a
and,
challenging. I mean, I was thinking to
Yeah.
myself, how can one establish there's so many unknowns, and it's very difficult to build this statistical model that it convolutes all the aspects and just connects one thing to the cause that cause to an effect. So many variables, and it must be very challenging to conduct this kind of research.
It can be, and which is why. So you have, on the one hand, you have experimental work is just hard to do from a practical point of view, and then you have observational work has, as you say, adequately controlling for all these confounders is a non-trivial thing, which is why I've really sought out the natural experiments. So so the emerald ash borer, the tree planting study, because I think they're a sort of happy medium in that you don't have to deal with all the difficulties of true experimental work, but you have you haven't got all the shortcomings of just a basic cross-sectional study. So that's why I've just personally been attracted to those sort of natural experiments.
Thank you.
Yep.
More questions?
And Georgie is, by the way, the cutest dog in the world. In case you were wondering, it's absolutely it's been shown to be true. That picture of her sitting in my kitchen with a hand knitted scarf on is particularly adorable.
Betsy had a question.
Yes.
Chat.
Oh, Betsy, wonderful presentation. Have you presented in front of City Hall in Portland or elsewhere? Important for our legislators to hear your voice.
I have in front of, I don't know if I've in Portland, wherever I present in front of, certainly in front of the Urban Forestry Commission. Have I spoken? I don't think I've spoken in front of City Council though. I'm always happy to talk to legislators. It's an interesting challenge. Yes, it's a euphemism, but I've also found, having talked to them, I've talked to other city councils around the region. I talked to Lake Oswego City Council and another one in the metro area. I can't remember now, over the years, but I've also learned what they find compelling. So, for example, I have some work on trees and house price, and that it kind of shows how trees can affect property tax revenues. And I can assure you that gets their attention real quick. Yeah, so the fact that some of their constituents might live longer, well, the fact that they might get their tax revenues might go up, and that's a different matter entirely. So I'm being only a little bit cynical. So I have learned, what some of the things that they find compelling, and I always like the opportunity to do that. So yeah, if anybody just invite me, and I will definitely make sure I get the right day.
I don't know. Oh, there's Aaron. Hi.
I was just mentioning that you were talking to a Washington County commissioner at this very moment, because Nafisa Fai is here. So hello.
I just wanted to say, I have to be bad-mouthing politicians.
Yeah, they're all around us, people who are making those decisions. So it's really lovely to see Nafisa in this conversation.
No, I'm glad hear. I'm glad that you listen to this and get exposed to this stuff with health in particular, because I think if you look at, I think that's the benefit, is that the gap between the true benefits and the understanding of them is there's such a gulf there, and that's where the opportunity for sort of education and moving, that's where the emphasis is most important, I think, because many people are just unaware that there's even any health benefits, let alone the magnitude of the health benefits. So yeah, I'm thanks for spending your evening listening to me blather on. That's very kind.
Liz, you have a question?
A question, but I just wanted to say thank you so much for speaking, and I just want to apologize for coming in late and disruptive, so thank you for muting me. But I really appreciated your presentation.
Thank you, that's very kind. And yeah, well, you were only slightly later than me, as it turns out. So.
Okay. All right.
I think we can wrap this up. Have a wonderful vacation or holiday, Dr. Donovan.
Yeah, thank you for the invitation. It was very kind. I really do like speaking to this type of group, and yep, I will, if you send me an email in a couple of weeks, I will follow up with papers and fact sheets, and if you do, I'm happy to go talk to the groups, including legislators. I'm happy to do that. It's a fun experience, fun challenge, and you know, just for me, that technology transfer part of my job I take very seriously, because you know I'm a publicly funded scientist. So the core of who I am is I'm a scientist, and you know, fiddling around with numbers, but I also take seriously the sort of duty to try and getting that information across to the people who can actually use it. So if you have other invitations, I'd be delighted to do it.
By the by, I'd like to honor Commissioner Fye has commented that she was very glad to. Commissioner Fye, unmuted.
Thank you, Fran. Fran, you sent me the invitation, so I'm so glad you invited me to this, and thank you, Doctor, for speaking. It's you did a really wonderful job of complex issue and breaking it down. And
not at all. Thank you. It's very kind
we'll
of
keep
you.
up the great work in Washington County and just do some good work, Fran. So thank you, everyone. And somehow I tried to write full sentence, but then it wouldn't and immediately send. So I apologize, the half sentence. But I was just gonna say, I'm glad to be here. Thank you.
Pleasure.
Well, have a good night, everybody. And we will have this recorded and up on available via our website. And hopefully a lot more people will be able to enjoy it, point them to that once it's all rendered.
And Dr. Donovan, thank you personally from me. Thank you.
Not at all. It's a pleasure. Bye-bye.
Bye-bye now.